Assessment Task 3, Operational Improvement for AIM Business School by Shane Ross. In this assessment, I will talk about 5 things that I expected to learn and how they've shaped my management and lessons learned along the way. My expectations for operational improvement is that I would be learning the methodologies and frameworks that would help me in my business life to improve the processes that we have. So some of those operational improvement cycles, some of the strategies, the management, how to mark excellence for those cycles and strategies and methodologies, and also how to use things like agile project management and fundamentals. And then what I'll also do is how that I've already used the operating envelope to standardize before trying to automate. I will also talk about digital operations strategy and how I use that in our workplace. One of my key learnings and takeaways from the operation improvement cycle was how to use the cycle to improve internal processes. So once I learned about the gap analysis and iteration, I then tried to apply it to some of the processes we have. I then looked at the process design. I would lay them out and map them, look at how the current business change management was structured, and then I collected some data and did some analysis. From there, I was able to use that new operational improvement cycle to time how long it was, figure out what the gaps were, and then implement that. This was really useful because we were able to find that we had slow onboarding of new staff because our CAD management, which is change management board, and our pre-change management board was very slow to react. And this was because we only had them once a week and we had a pre-CAB, which means there was a minimum of 2-week turnaround before IT or any other department would make any changes. So one of the changes that I put forward to the business, that was a hiring of new staff, because it was already approved by HR and signed off on, didn't have to go to a pre-CAB, that it could just be put in as a standard change. Now this would change the cycle by 1 week and then reduce the time by a week. I then, as a second cycle, went in and had a look at what was the same about all of them, what could we do in less time. And all of them had the same key requirements, occupational health and safety learning, because everybody had to do it, and made sure that all of the systems had that pre-done in a template before we even started. Operational strategy is one of the key things that I took away from this course, because some of my learnings were how well does the current operation strategy support their overall business goals? Are those areas within the operations, can they do better? What are they achieving? What's the company vision? And also the core objectives. We always have to remember this when we're setting these operation strategies to make sure that they align. Not only that, it's cost reduction, efficiency, quality, and customer satisfaction. These are all trade-offs that need to be balanced when we're coming up with a strategy. And that's why we have to make sure that they align with what the business's outcomes are. After we've done all of that, what we can really then look at is the process optimization. What are we looking to get out of the process? Is it time? Is it money? Is it efficiency? Also, the supply chain management. Just in time is one of the key takeaways during the supply chain management. And during that, what we should really be doing from our side of it in our business is trying to order far enough out that the supplies get to us in time, and only order what we need, because of the challenges of food, medical equipment, and supplies need to be on hand when we need them and can rapidly change. And then what we should be doing then is checking the performance and the risk and making sure that it's sustainable. And then at the end of that, we'll go into like a Kaizen loop where we continuously improve and check the efficiencies of what we're doing. Operations management is one section that I work in a lot because of the new artificial intelligence, serverless computer, automation, mobile and digital communications, culture and workflow experience. This is so important because my day-to-day job is about engaging people with technology and helping them go from having no digitalization or digitization, getting them to use those technologies, the Internet of Things, understanding it, and then being able to use those new processes and the new management of those new processes to deliver an outcome to the business. And some of the ways we're doing this is through lighting systems, healthcare monitors, heart monitors, wrist monitors where you can see all this information and technology. And the operation and management side of this really comes in because it has changed a lot over the years. And I got to learn a lot about, operations management 1, 2, 3, and now 4, and what the differences is and where we're heading. Knowing and understanding all of this, I'm able to better understand and deploy new operations management. One of the things I've done at work is look at HR and how we can use those systems, like training, to better help everyone at work. So when people go home, they can do training, or they can work from home if they're sick and not have to use sick days. And they can do instructor-led training from remote. Not only that, they can also do self-paced training. These are some of the things I've actually put in place with a digital solution and just-in-time training so that people don't have to wait for a class to start their training in education, which is very important in the health industry for doctors, nurses, and other healthcare professionals. My expectations for operational excellence was that I'd get taught a framework and a way of working out how do you show operational excellence? What is operational excellence? And I was given a good framework that talks about, the vision and excellence. So I learned that having a good vision and also defining what excellent is and what it is to the company. And this is all done by the leadership. And this gives us direction and a goal to hit that. Then aligning that up with strategy becomes a key point. We develop the operational strategy that must align with the customer's wants and needs. And then that brings me on to the next point, which is the customers. We have to know who our customers are, what the customers want, and be able to work with those customers. Because they're the people that we have to make sure that we get good feedback and we can supply them with good services. Which comes down to my last point, which is workforce. So workforce is extremely important because we have to make sure that they're well trained, they have good knowledge of what those operations that are going to support that strategy are. And not only that, there's accountability. And that gives the accountability to the customer that the customers are going to get what they want each time and that we are delivering what they want each time. And because we have the vision and we know what excellence is, we can measure that. And then once we start having measures and accountability from staff and well-trained staff, this is how we define what operational excellence really is. One of the things that I've already implemented at work is a digital operation and automation. So I learned about operational envelope and how that could help me set what the minimum maximum standards are before I try to implement it. Not only that, to measure, plan, implement my change, measure it again, and then make changes as needed. So what I did is we looked at the onboarding of new staff members. It was taking between 4 and 6 weeks once someone was already onboarded before they could actually perform any work. So knowing this, I knew the minimum was 4 and the maximum was 6, and that we had a large operating envelope because there was no real standardization yet. So we set a standard. This is what everybody needs. They need occupational health and safety, they need access to the systems, and we made a template. So having this plan that we'd made out, we knew what our minimum and maximums were. We knew we could measure it. We then implemented that first change by making them all the same and setting a standard. What we then did is we remeasured it again. We took our minimum and maximum and found that because they're all the same, we were able to reduce that window down to just 4 weeks.